I'll tell you the process we're going through in Alberta, because I know that it's a little bit different for Lloydminster. I believe the hospital system as well as the school system fall under Saskatchewan Authority, and then we have a cost-sharing arrangement for our percentage. I think we pay about 60% of the cost. So the approach we're doing in Alberta is we're trying to assess where the acute care beds are needed, because in fact what we found is that we need to have more home care, more long-term care, more mental health and addiction spaces, and those are the spaces that we're trying to build first, because we have many of our hospitals where patients who are alternative levels of care are actually in acute care beds. So that's the first step that we want to take, is get the patient in the right place, getting treated the right way, and then do a proper assessment of what our acute care needs would be. But I'll turn it over to the Premier to talk about Lloydminster in particular.
Right, and across Saskatchewan we've gone through much of the same processes. For the first time over the last 15 years or so, we're actually growing in population, and Lloydminster has been fortunate to be in that place of growth for many decades now. And so I don't have an answer on a Lloydminster hospital today, but I would say that we are constantly looking, and in the case of Lloydminster, alongside the province of Alberta, as to where our next investments are from a healthcare, acute care, hospital bed perspective, where they need to be located, what is the age of the infrastructure, and all of that is going through that process all the time. And our health minister, just living down the road in North Battleford, I think we'd be more than happy to engage with any local healthcare foundations as well as the municipal government on what the long-term planning for healthcare here in the province, including facilities, might look like.